Good afternoon. Good afternoon. Thank you to have me today. I'm so thankful and so grateful to IDLAB team and all the colleagues to give me this opportunity today to talk about briefly my main activities. Okay. Okay. So you said everything. Thank you so much. So of course, I'm Dr. Mohammed Baby. So I'm in charge of emergency medical care, stabilization, management of casualties in the field. Today, I have the honor to brief you on the UN mission SOP policy on the management of war zone casualties, means evacuation from the field. I have a background of 26 years working in the UN mission from Afghanistan, Iraq to Somalia, where I'm currently based, Sudan, East Timor, Timor-Leste. So my main activity is to take care of those soldiers. Our current mandate is to support African Union mission who are fighting across Somalia up to Sudan. So doing that one to facilitate the evacuation, the management of the patient, we establish a information system in place using in all our medical facilities to gather the information, hospital information system through a software. Not only the patient, we are managing also the medical supplies, vaccine, drugs, consumable, etc., to the troops in timely manner. This hospital information system is just a pilot project. We start here in Somalia. We are duplicating in others' mission for accountability, accuracy, and provide quality care in the UN field mission. What is this information system and also the problem we had before we established this system? It was not easy as we are working remotely most of the time, and the purpose and also the function, the system use, the advantage, the inconvenience of this system. More or less, the system is more benefiting than inconvenient. So the information, what first is the hospital information system is about what? It is an information system using this data. It helps to save the record of the patient, facilitate the movement of the patient from one point to another point using the same software, transmitting on time the medical file of the patient to respond quickly for life saving, time saving from one country to another country, to evacuate on time, to minimize the cost, saving life, and is basically designated to manage the patient also, their information, their historical, and also we use the same system to better manage our stock, to put a stockpile, to put the buffer stock in case of any disaster. Currently, we are facing a disaster by a flooding of more than 7 areas, and most of the cholera cases are rising, associating to malaria, typhoid, and also snake bite, scorpion bite on such kind of area. So we put in place the management of our medical stock, inventory management is not only the patient, but also the inventory management of the drugs and consumable, and to provide a quality care. Before the system, we used to have, we had a lot of problem and challenge based on the paperwork, and also the safekeeping of the patient record were not guaranteed. Like we had in the past a lot of incidents related to fire for our stock, for by the flooding, and also to facilitate the possible movement of the patient to higher level medical care. So seeing that one, we use what is the main function of our information digitalized system is facilitated to make appointment quickly, facilitate easy communication from the physician on the field. They communicate, they provide the information of the patient to provide a quick diagnosis, then to save life and perform conversation with the doctor. A doctor sitting in Khartoum can discuss a case with a patient sitting far in another region. The same system can also help for capacity building training to the African Union troops to enhance their knowledge on the common diseases we are encountering and also the ICLS, Advanced Cardiac Life Support at pre-hospital. It manage also the constantly, if necessary, if we have to provide any change, a protocol we provide if we found by WHO and UNICEF. It helps also to provide the immunization and vaccination to respond quickly to any outbreak, which is the case when we are moving. And not only that one, it can also help us, it's helping us a lot to safe keep the record of the patient. We are no more going to the file because we can move from this site to another site, so we cannot carry out the paper with us. This system is very accurate, and on top of that one, we can liaise with the physician from the higher level, like level 3 hospital. I'm gonna to get back there. So using this system, we provide the information before we decide if the patient has to be evacuated. We start here, this pyramid, where we have the sector, region, basic field hospital. They rely from there, we go to the level 2, which level 2 hospital, which is the second step. From level 2 hospital, if the patient is stabilized, we can discharge the patient or we repatriate if he's not fit anymore to conduct his mission. Or if it is a severe cases, we can evacuate it to level 3 and level 4. United Nations has paired the policies. This level 2, for example, is based in Mogadishu. We have in Khartoum, we have in other sectors. So if the patient is not stabilized for the next 72 hours, with the same system, we can constantly monitor the vital sign, conducted the TDM, CT scan, MRI, and refer to the level 3 hospital in Kenya, Nairobi, or if it cannot need be for some severe cases, we evacuate to South Africa. We have a contract with Millie Park Hospital in Johannesburg. So this information system is also need a lot of requirement. Like for example, the documentation, it helps us to maintain the record for legal purposes. For example, a soldier who is killed in action, so it helps us to maintain legally the record and transmit for the BOI and transmit to our company insurance safely, and also with keeping all the document for further. And we are using also this this system require also IT facilities. Like for example, we need the Wi-Fi, we need the computer, and also to conduct some exam like ECG, X-ray, ultrasound, and it will help to, this is follow up to send it to the higher level. Like for example, you can see display on my screen some equipment like 1 year ago we procure and we dispatch to all the mission. This is a ultrasound, digital ultrasound machine deployed in UNSOS here in Somalia. So we can have, when we have a fracture, so we can send it to the the specialist, a radiographer, then the radiographer will provide his input and the decision to be taken will follow. We have also such kind of the X-ray, the digital X-ray. This digital X-ray is common. It's very easy to move from point E to point B and provide also accurate diagnostic and provide adequate treatment on time. Then we are using also the same technology through the system to provide a training, and also we are supporting the Somali army forces for their capacity in the combat and help to enhance also and to improve and to upgrade the level of any facility when there is needed. So that is mainly this one. So the information hospitals, the system is very benefit for all the troops. And we can consider this like a pilot project, and we are duplicating to other mission again. That will be beginning next year, around February. I will have a chance to update on this. And by next, due to the time, I cannot go furthermore. I will stop here. So we have the software is a very benefit for the stock and inventory management we are using to support. And the vaccination program, we use it to provide the COVID vaccine on the ground, currently for the cholera vaccine. And Ebola is also very frequent here. So we can record and it can give us the booster dose, and it's very useful. So thank you. So that is mainly what we are doing. Due to the time constraint, I will stop here and we develop furthermore. So thank you so much.